Thank you for viewing our research. My name is Yihan Wang. I'm presenting our research titled Challenges and Facilitators for Physicians and Medical Schools to Promote Social Accountability in Rural Communities, a scoping review. We have no relationships with for-profit or non-for-profit organizations. This session/program has not received financial or in-kind support of any form. The World Health Organization has defined the social accountability of medical schools as the obligation to direct their education, research, and service activities towards addressing the priority health concerns of the community, region, and/or nation they have a mandate to serve. Research concerning social accountability implementation strategies and efficiencies on the patient-physician level and framework has been afoot with an insufficient overview of the current landscape. This scoping review provides an overview of the existing literature landscape of promoting social accountability practice of physicians and medical schools in a rural setting, with perspectives of the barriers and facilitators inherent to the communities. This scoping review was conducted following the RT and O'Malley framework. Medline, Web of Science, Embase, Scopus, and CNOW were searched for peer-reviewed studies published since 2000 in English. Inclusion criteria included primary studies of any design. Studies should either be conferred from a healthcare perspective by physicians or medical school faculty, or studies of generalized claims in the above two areas without directly communicated human participant involvement. 53 studies were identified for final extraction. The most discussed facilitator for medical schools to promote social accountability, comprising 62.22%, is attributed to the community-centered curriculum. Admission intervention represents 17.78% of the overall strategy. Faculty perception or attitudes towards social accountability interventions accounts for 15.56% of the total efforts. Financial intervention constitutes 4.44% of the implemented strategies. The most discussed facilitator for physicians to promote social accountability is physician-community immersion, occupying the largest share, comprising 43% of the overall strategy. Peer support intervention constitutes a significant portion at 19%. Perception or attitudes intervention makes up 38% of the total intervention efforts. Curriculum incompetency emerges as the predominant challenge or barrier to promote social accountability, constituting a significant portion at 55%. Lack of financial support represents 17% of the identified challenges. Remoteness of the location is noted as a factor, accounting for 14% of the challenges. Less developed infrastructure mirrors the same percentage, also standing at 14% of the identified obstacles. Decline attitude is the most prevalent barriers to promote social accountability, representing 43% of the issue. Preference and bias contribute significantly, accounting for 26%. Geographic isolation is identified as a contributing factor, making up 17%. Poor work conditions are also recognized, comprising 14% of the overall issue. Figure 5 demonstrates the number of articles published per year from prospective countries since 2000. An increasing focus on social accountability issues is demonstrated, particularly in the regions such as Australia and Canada. Qualitative study emerges as the most prevalent design. Cross-sectional study and longitudinal study follow. Other designs, such as case study, Mixed method study and retrospective cohort study also contribute to the research landscape, showing a diverse range of methodological approaches employed to address social accountability.